Hi, everyone. Chris Lewis from Fox 47's Digital Newsroom. Today, we are talking with Amit Sachdev from Michigan State University. He is the medical director of the Neurology Clinic at Michigan State University. And we're talking to him about the at-risk population that he is working with. He works with a lot of rare diseases and patients with rare diseases that are at definite risk of COVID-19. And they're having to deal with these patients in different ways now, just like all doctors are. Dr. Sachdev, thanks so much for being here today.
Thank you, Chris, for having me.
It is my pleasure to have you here. I want to give people an understanding of the patients that you're working with. I know that you're working with rare diseases. Talk to me a little bit about some of these patients, what they are dealing with in that regard right now.
Well, Chris, we at Michigan State University have a lot of specialists in areas of neurology. And some of our patients have trouble with breathing. Some of them have trouble speaking, understanding. They are across the board just very medically complicated. And those are the patients that we're concerned may not do well if they got infected with COVID.
I'm sure there's a lot of fear, there's a lot of concern, there's a lot of things that you're having to do to be able to alleviate those fears and concerns. And I'm sure that you've had to make some pivots to be able to treat your patients and to be able to handle those fears. Talk to me a little bit about how you've had to make those pivots to be able to best meet the needs of your patients.
Well, we've done two things. First is that there are just some patients who still have to see us face to face. The governor was clear that only life-threatening or limb-threatening kinds of issues need to be seen. But in neurology, that is what we do. And so some patients have to see us face to face, and we've really enhanced our cleaning. We're wearing masks, everything that you would expect of an organization. For the vast majority of patients that don't have to see us face-to-face, we're doing telehealth. And in fact, last week, we connected with 95% of our patients using telehealth.
As you're talking to these patients, what are you finding are their largest concerns right now in regards to this virus that is impacting so many?
The really unfortunate thing that we've heard is that when the national conversation really starts to talk about rationing, that these patients feel like they would be left behind. And trying to alleviate some of those concerns has really been a major task for us.
If there was one thing that you could say for people to best understand, the needs of these patients, but also what you're telling people in regards to staying safe, what would you say to them right now?
I'd say two things. The first is that if you have a neurologic illness and we've placed you on a medicine for that, you probably need to keep on taking your medicines. Having an unstable neurologic illness is not a good thing. And those medicines are probably keeping your disease stable. The second is that people with neurologic illnesses have really full and meaningful lives. And so that whole national conversation really shouldn't exclude these patients.
Well, I really appreciate you sharing that. I appreciate you being with me today and giving us at least some insight into some of the concerns that some of these patients are having, because it's a scary time for a lot of people just not understanding, and for people I'm sure that are dealing with diseases that need the assistance of healthcare right on a regular basis. It's even scarier. So, I commend you and your team for the innovative practices that you're doing, and wish you all the best as you continue to work with your patients and being on the front line of all of this.
Thank you so much, Chris.